Whether diabetic patients can do fasting depends on various factors, including the type of diabetes, the individual's health status, and the specific fasting method. Here's a more detailed breakdown. 1. Type 1 diabetes. People with type 1 diabetes generally cannot fast due to the risk of developing diabetic ketoacidosis (DKA). This is a serious condition that occurs when the body cannot produce enough insulin to break down glucose for energy. As a result, the body starts to break down fat for fuel, producing ketones as a byproduct. Ketones can build up in the blood, leading to acidosis, which can be fatal if not treated promptly. 2. Type 2 diabetes. While some people with type 2 diabetes may be able to fast safely under the guidance of a healthcare provider, it's important to consult a doctor first. Fasting can affect blood sugar levels, and medication adjustments may be necessary. Factors to consider include the severity of the diabetes, the individual's overall health, and any other medical condition. Intermittent fasting. Some studies suggest that intermittent fasting may be beneficial for people with type 2 diabetes. This type of fasting involves alternating periods of eating and fasting. However, it's important to approach intermittent fasting cautiously, and consult a healthcare provider. Individual responses to intermittent fasting can vary, and it's essential to monitor blood sugar levels closely during this time. If you have diabetes and are considering fasting, it's crucial to discuss it with your doctor. They can assess your individual situation, provide guidance, and help you determine if fasting is safe and appropriate for you. Remember, fasting can involve risks, and it's essential to prioritize your health and well-being. It's always best to consult with a healthcare professional before making any significant changes to your diet or lifestyle.